This is Kelly Sheets. I am with DMS, and I will be your host for today's meeting. Erin is out on maternity leave, so I have 1 o'clock. I don't believe we have a quorum yet, unless I missed someone through the waiting room. It looks like we have Russ, we have you, and then we have Danny Harris, but that's all I see.
This is Nina Eisner. I'm on telephone. I couldn't Zoom. I'm not in a Wi-Fi place, but I'm on the phone.
Will be recorded, and the purpose and intent of the recording is just for finalization of the meeting notes, which will be shared with.
Lori Richie Baldwin is joining now.
Okay, that'll give us a quorum. Teresa Fite's not going to be on. I've not heard from Elaine.
Okay.
Division of Health Plan Oversight specific to.
It does look like you have a quorum now.
Okay.
I would just like to remind members, when you are voting, in order to comply with Kentucky's open meeting laws, if you are voting, please turn on your camera while voting. Thank you very much. And Russ, I'll turn it over to you.
Okay. Welcome everybody. We've number 2, we have established a quorum. We've got Danny Harris, Lori Richie Baldwin. Lori's a new board appointment, filling Steve Oglesby's vacancy, who's retired. Hi, Lori. I know everybody's familiar with you, but you want to introduce yourself? You want to introduce yourself, Lori?
Oh, yes. Sorry about that. I didn't hear you. Hi, everyone. Lori Richie Baldwin. I'm the CFO for St. Elizabeth Healthcare in Northern Kentucky. Been with the system about 11 years. And just really get a lot out of this group and what comes out of it. So I'm excited to be a part of it, taking over for Steve's retirement. So thank you.
I appreciate you joining us, Lori. Always that's a
Hey,
great.
Bud. It's Nina, and I know she said when we vote, we have to be able to show ourselves, and I don't know how to do that from my phone. So.
I believe we have a quorum not counting you, so you would not have to vote if you can't turn your camera on.
And I see Elaine joining us now, so that's
So you're good. Okay.
so we're good. Yep. Okay. Approval minutes from the old meeting. The minutes were sent out to the members. Any edits or adjustments? If not, do I have a motion to approve the minute?
So moved.
Danny?
Yes.
Okay. Second, do I have a second?
This is Elaine. I'll second.
Okay. Any opposed? Okay, motion passes. Old business. Last meeting, we talked about the Molina Emergency Department. I'm looking for an update to see if last 2 months ago, the criteria was not available. Do we know if we have criteria available to review or go through yet?
Hi, this is Courtney Kelly from Passport by Molina, and I think we'll have to take that back to our leadership team. I believe that the process or the status today is that there are individual conversations going with each individual facility, and I think that's where we're at today. I think that they're kind of still building out that plan, so I will take that back to our leadership team to get some solid information out as soon as we have it.
Okay.
Hey, Courtney, this is Nina Eisner. That's a global, isn't it, on the
It is.
the call from, yeah, okay, I just wanted to make sure.
It is. It's criteria around the ED visit levels and the exceptions to the criteria, because the last meeting they reported that there would be, there were multiple exceptions that they would be in work.
And just for my information, how long has it been a global on the DMS MCO call? Courtney, do you know?
Nina, are you speaking of the KHA call?
Yeah. Mm-hmm.
Okay,
Or when was
yes.
the,
Because
when was
this
the
is
policy, when was the policy approved by DMS? How about that as a better question?
I don't have that date in front of me. I'll have to go back on that to give you the exact date. But it has been on the KHA log for at least 2 months now because they're just ongoing conversations. So there's definitely additional information that we'll be sure to get out to each of you as soon as we have it.
Do you have a
So-
target date for completion on this?
I know that we are very close to completion on finalizing the plan. So, but I don't have an exact ECD on that.
So clarifying question, is the policy being applied to anybody?
At this time, it is not, no.
All right. If you could let Kelly know when we have an update, she can respond back or let me know and I can send it out to the group about the criteria and when the update may be available so that we can review it.
Absolutely.
All right, and the second follow-up on that, the question was asked to VMS about, what constitutes clean claim and what would be subject to when interest would apply. So if I submit a claim and they ask for a medical record, how long do they get to review it? And they're trying to determine, and is that a clean claim or is it not a clean claim?
Hi, this is Justin Derringer with Department for Medicaid Services. I have, I believe Jennifer Swingle's on. She is in our administrator for the hospitals program. We may need just a little more information on that one, as it seems a little unclear to me. Maybe she's a little more clear on that.
Okay, so the DMS has approved a prepay review policy with Molina Passport on the emergency room claims, emergency department claims. And they are still working on the criteria about exceptions, how it would be applied. But my question to DMS was, at the last meeting was, when I send in a claim for emergency room or emergency department visit, and essentially based on, they're going to ask for medical records based on a level, nothing else, at least in my view. So if they ask for a medical record based on a level, we can have a whole discussion about ED levels and what the level should be and what guidelines aren't there. But in my view, that's a clean claim, and they're on the clock. And if they take 35 or 45 or 90 days to do a medical record review, in my view, they should be paying. And they come back and they pay the claim, deny the claim, reduce the level. It should be with interest. And I wanted clarification from DMS on my viewpoint. So that's the question.
Okay, yep, I understand it now. Much better that you explained it. Thank you for that. I don't have an answer right this minute, but I can promise you I'll get you one as soon as possible.
Okay.
Thank you.
And they can't have an open-ended prepay review, right? To look at something forever without interest kicking in. It's not, especially when they're doing a fishing expedition, in my view. So it's not reasonable. So that's the question. Anybody else on that from the TAC? Any other comments before we move on? Okay. Incarceration data, it continues. I know we had an update last meeting. We continue to get the hospitals through KHA reporting issues in the system. We had a few of those sent by one member hospital, and we sent those examples over. And something we want to keep on the radar. We all know it's multiple issues and noise and incarceration data. But any feedback or update to the examples that were sent?
Hi, this is Leanne Fitzpatrick with the Department for Medicaid Services. And I have put in the chat a process. If providers are seeing denials or recoupments from MCOs with eligibility and incarceration dates, the process is there. What happens was when APRIS updates and puts information into the MMIS system, sometimes the dates get switched. And Justin might have a little bit more information about that, but that is the process to do if you have anybody that your claims need to be fixed or anything like that.
Okay. Leanne, would you email that to me so that I can, I can't write that down. Would you mind copying that and emailing that to me so I can send it out to the group as well?
Sure.
And make sure it's in our minutes.
Leanne, if you'll send that to me, I'll put everything in a meeting follow-up email and send it out. That way we're
Okay.
not.
All right, Kelly, I'll get it out to you. Thank you so much.
Thank you, Leanne.
Thank you, Leanne. Thank you, Kelly.
Absolutely.
Any other comment or feedback from the group attack? Okay, next item, update on the 2023 HRIP status. Is there any news?
Still monitoring we're continuing to monitor the House Bill 75 in the current session as it moves through the legislative process, and we're still working through the approval process with CMS at this time.
And we're waiting on CMS to respond. Is that correct?
Right. Well, we're really waiting on the approval, give me the legislative authority is the main thing right now is this House Bill 75. I did share with the work group that we have a weekly work group, and I did share with KHA that it did pass the House unanimously, but it was a amended version, and in that amended version, they removed all my appropriations. So I can't, you can give me the legislative, I can have the legislative approval, but I also need the budgetary approval as well to process those payments.
Okay.
But we're working through that process right now. So
KHA is aware of that, right?
yes, sir.
Okay. All right. Thank you. New business, the DMS process timeline on the end of the PHE. I know there's been a lot of information that's gone out there. I know there was a meeting today. I saw the slide deck on that. It looked very informative. Any update that you can give the TAC group? Anyone from DMS?
Chris, I can barely hear you. Are you addressing A under new business?
I apologize. Yeah, so the timeline for the end of the public health emergency and Medicaid eligibility determinations. I said, I know there's a lot of information that's gone out. I know there's meetings that have been had. There was one today. I saw the slide deck. It looked like it was very informative, but I just wanted to have this. Is there anything for the TAC or any update or anything that we can notify the hospitals to be able to help with in that process?
I think Veronica Judy Cecil was on, but she just texted me and said she had to step away. So if she gets back before the meeting is over, she can address that. And if not, we'll have to postpone it or send information out at another time. I do apologize.
Okay. All right.
Hey, Russ, it's Hal. There is a call on Thursday that KHA is hosting from, I think, noon to 1 o'clock regarding eligibility for this. So it went out to over 500 recipients via email from Claire Arant. So if y'all don't have it, if you would reach out to Claire there should be some discussion. Carl's, I think, the one that's going to be hosting that. So, FYI.
Is that the one that's on presumptive eligibility?
Yes.
So I got a question last week if we were able to track those individuals that had received presumptive eligibility. And our answer here was yes. And I guess from the TAC members, are you guys able to track what Medicaid members do you know that had presumptive eligibility? Do you know, Elaine, Annie?
Sorry, I couldn't unmute quick enough for us. We are working on that, but we have not began the process yet.
Okay.
Same for us, Russ. That's where we are.
Okay. Okay. All right. We set
And
them
Russ,
up
we
as
do have that, we've identified that list of folks.
okay. We had two. We had set them up in a different category in our patient accounting system, so we could identify them pretty easily. I think that's I think there's desire from the DMS side to have those lists, so that I think what the call is about on Thursday that Claire set up. All right. Next item, update. So the 2020 MCO selection challenge that went through the appeals court, there was a decision, I believe, last September. Is there any update on that? Is the appeal still going on? Did Anthem appeal it? Can somebody update us on the status of that, please?
Hi, good afternoon. This is Veronica Judy Cecil, Senior Deputy Commissioner Medicaid. It's nice to join you all. I don't usually get the opportunity to, so that is still in court. So there is no change in the status as of now. And if we have no idea, we can't predict the court system, so we have no idea when that may change. If it does, we certainly will notify all the stakeholders to let you all know what is happening and how that impacts the program.
So Anthem appealed it, and then Anthem appealed it, I guess, to the Supreme Court?
Yes, that's my understanding of what the next step was.
And then the current contracts run through the end of calendar 24. Is that correct?
The base contract runs through December 31st, 2024. There are renewal options on that contract.
Okay. Questions from the TAC?
Russ, do you want me to take this opportunity to talk a little bit about unwinding?
Yes, please.
Okay, thank you. And I don't know how much time you really want me to take up, because I could take 30 minutes, I could take 2 hours. But just I think at a high level, and to note that you know, we're happy to come back and provide maybe additional time and deep dive into it. We're also working with the Kentucky Hospital Association about doing a presentation to all the hospitals. So be on the lookout for that information. But we are in the start of unwinding. I've got if it's okay, I got a short presentation that
Sure.
might be easier to sort of walk through. And I'm sure Kelly is quickly trying to make it so I can present my screen.
You should be good to go, Veronica.
Thank you. Let me do this. And there we go. So our top 3 goals are, of course, we don't want administrative terminations. That's critically important to us, is to make sure that someone who is eligible and going through a renewal doesn't terminate or discontinue as a result of some administrative reasons. So we oh, it's popped off, didn't it? You all seeing it?
I don't
No,
see it
can't
right
see your
now.
screen.
We do not.
Okay, thank you. Try that one more time.
There it goes.
There it
Now
goes.
we can see.
Okay, great. My little thing isn't showing like it normally does. So we want to make sure that there is no break in coverage if someone is still Medicaid eligible. And we're focused on that. We're anyone who is no longer eligible, we've been able to determine that they get moved to other coverage. And I'll talk about that in a little bit, in just a few minutes. And then, you know, we do need to comply with CMS. Our federal match is at stake, including our enhanced federal match that we've had over the course of the public health emergency. So we do have to be in compliance to make sure that we maintain that. We have been given notice, and you probably have heard that the end of the public health emergency is approaching, and that will be May 11th. On that date, it means that there are flexibilities that will absolutely end, and we'll talk about that in a minute. We have, and to the extent that we are able, have looked through to see what can we extend, what can we make permanent, but we're going through that evaluation. And then I think the biggest change for most folks, and this was prior to the announcement of the White House about the end of the PHE, was a law that passed in December that really is the reason why we're restarting the annual renewals. And that legislation did require states, or at least ended the continuous coverage that states have been utilizing to keep people covered throughout the PHE. That ends on March 31st, 2023, and that CMS expects states to resume normal operations for eligibility and enrollment. So that bill also is going to phase down our enhanced federal match, which means that, you know, it kind of is more important for us to make sure if somebody is ineligible for Medicaid that we're discontinuing them so that we're no longer carrying that coverage or that cost for those people who are ineligible. And then there were some other additional requirements put on the states with regard to reporting. So we've been quickly trying to adjust our reporting to be in compliance with that. And then there were a couple of other things to come out of that. This is a very high level timeline of just the renewals. There was reporting that was required on February 15th that included a renewal redistribution plan. That is the plan that Kentucky will implement to distribute the caseload over the 12-month unwinding period. And so we looked closely at our workforce and their capability and capacity, and looked to see how can we allocate that across the 12 months to consider those impacts, external impacts. As I mentioned, the March 31st, 2023 is the end of continuous coverage. So anyone who comes in after that date, any new enrollments no longer have continuous coverage, and we'll start to unwind. It's important to note that that doesn't mean that people who are currently in Medicaid their coverage or end. It just means that that's for new enrollees, and it kickstarts the 12-month unwinding process. So until their renewal date comes up, they are still continuously covered, regardless of a change in circumstance. April 8th is the next date that we'll have reporting to CMS. This will be our baseline report about all our renewals. It's a snapshot of what the state is looking at in terms of the caseload. And it will be the underlining report that we do on a monthly basis to CMS that demonstrates what the data is showing us in terms of who's been renewed, who couldn't be renewed, who was discontinued, who moved over to other coverage. So that'll be a report that we'll be sending to CMS on a monthly basis. And let me add that we're going to post all of these reports on our website. So once we submit it to see it, like the ones we sent on the 15th, we submitted to CMS. We're waiting for CMS review of that. Once CMS completes their review, if there are no other changes, we'll post those. So then the next date is May 31st, 2023 is the first end date, renewal end date that will go through renewal. And that means that those folks will receive a notice in early April that they are up for renewal in May. And just to talk through what that process looks like, we'll send out a notice to folks that have a renewal date in May. They'll get a notice, either text or email or both, letting them know in March that they have a May renewal. So approximately 90 days before their end date, every member will receive some type of notification that their renewal is approaching. We will, on April 1st, try to what's called passively renew or automatically renew everyone that can be renewed electronically by going out and verifying information. And so our system will try to do that automatically. And if they can't be renewed, then they will be issued a request for information so that they can provide us the necessary information to do that determination. We have other folks that we are unable to passively renew, and those are primarily folks that have some type of a resource test for their eligibility. They'll receive a renewal packet, and they'll have to return that renewal packet to continue. So that's what's going on with the start of renewals for May. So in early April, they'll be told either we were able to renew you, so they'll get a notice of eligibility saying you're done, nothing you have to do, there's nothing to return, we were able to verify you, or you'll get that request for information or renewal packet. And then we'll conduct those, again, we'll conduct those renewals over a 12-month process. Oops, sorry. Just really quickly, there has been thought to what we're doing. We've stayed on top of all the guidance, and it's been a challenge, I have to tell you. I mean, just as early as a couple weeks ago, we received new guidance from CMS. So we're constantly having to take that in, review it against our plan and what we're doing, and make tweaks and changes to it. That's made it a challenge to tell people what we're doing, because it is constantly changing based on that guidance, and has required a lot of time and energy on our system, making sure that, you know, when we go live with renewals, that it's doing it as accurately as possible, so that, you know, we don't see any gaps in coverage. We plan a very extensive communication plan, and I'm going to talk about some of those here in a minute, but we really want everyone to understand what's going on. We know it's going to be an effort across the entire state, amongst all stakeholders, to support our Medicaid members through this process, because we don't want, we don't want people to be administratively discontinued as a part of this. This is what I was talking about, our caseload planning. So we do have a renewal distribution plan. We've got over 900,000 cases. So we do process at the head of household level. But, you know, we are renewing over 1.5 million people that are in those 900,000 cases. So we've distributed those across the 12 months, keeping in mind, for instance, not a really large caseload or the highest caseload in the first couple of months of the unwind, because we want to make sure our system is processing correctly and the workforce is able to adapt. So lower caseloads at the very beginning, a lower caseload in December, taking into consideration fewer work days because of the holidays, as well as open enrollment that starts. And then our highest caseloads are toward the end of the unwinding period, because that will allow us to really forecast what our workforce needs are and be able to ramp up as we need to. There's 3 populations that we are allocating a little more specially than the rest of the population. And those are, there's about 14,000 people that we have been doing what's called a special circumstance every month since the beginning of the public health emergency. These were individuals that were set to discontinue. We had already determined they were no longer eligible, but due to the continuous coverage requirement, we put them back on. And those folks, because we've determined them no longer eligible, they are in that May bucket so that we can focus on them and make sure that if they do have a change in circumstance, that we're taking that into consideration. The next special population is the Medicare eligible. So we had a lot of folks turn 65 or older during the public health emergency, but because of continuous coverage, we kept them in Medicaid. These folks may or may not have enrolled in Medicare like they should have. And so we want to make sure this population, and there's about 15,000 of them that we want to, and we're going to allocate them May through October, because we're going to focus our efforts to help them enroll in Medicare. They also will get a special enrollment period as a result, thanks to the federal law granting them an extra time up to 6 months to enroll upon Medicaid disenrollment, and that they can do that without a penalty. And then the last population is those that our system has determined probably are ineligible because of income, excess income. This is what we call our QHP, or Qualified Health Plan population. These are the folks we really want to make sure that they understand they can go to the state-based exchange Connect, and they can shop for a plan that they can immediately enroll into, and hopefully with no gap in their coverage from Medicaid disenrollment to enrollment in the new QHP plan. But we want to make sure they know that that's available to them, and there's going to be a lot of support. The reason we're delaying them until July is because we're doing some things with our system and with our processes that will really support these folks to be able to get access to those plans. There are flexibility. Yep.
UHP about?
Oh, so about 76,000. So, and that's just, that's what our system tells us right now. Things can change, their circumstance. By the time they have a redetermination, their circumstance could change. But right now, our system is identifying about 76,000 individuals that will have to roll over to QHP. They also might have employer-sponsored plans available to them. So again, at that point, we'll be working with the individual to try to make them understand what the options that are available. And that the population will have a lot of support from the managed care organizations. They'll be outreaching to this population separately from what we're doing, just to make sure that we can reach the individual and they understand what's happening. Great question. So PHE flexibilities are ending, and we could talk longer about this, and happy to maybe come back and do that. But there are some that are going to end that we have no control. We have to end them. It's not something we can extend or make permanent. So there's a couple of those. One that you should be aware of is that our second presumptive eligibility period is going away. So on May 12th, we'll no longer have that available to individuals to help them make that full application to Medicaid. So we'll go back to one PE period. provider revalidations restart. A lot of providers have just voluntarily been doing their revalidations anyway, but we'll have to start getting providers into compliance with that revalidation requirement. So you'll hear from us about, you know, your upcoming revalidation and the need for you to take action. We had some providers that temporarily enrolled, and that was permissible under the public health emergency, but they'll have up to 6 months to enroll permanently if they want to continue to submit claims on services they're providing to our members. The other one I want to talk about is the hospital will be returning to the pre-PHE provider reimbursement, and that includes, you know, the hospital 20% add-on for the DRG for COVID-19 goes away on May 11th. So on May 12th, we'll no longer be able to pay that. The best way to stay informed, we do have a website. If you're not familiar with it, medicaidunwinding.ky.gov. That's the place we're really going to keep all of our information. Our reports are going to go up there. You know, as we add flyers and other literature, that's a good place to pull that down. We encourage providers. We're trying to have flyers and other materials available for providers to pull down and maybe post in your offices to keep our members aware of what's going on. We certainly would appreciate that. Social media, if you don't follow us on social media, at least Facebook, Twitter, or Instagram, on one of them, I do recommend that you sign up, because that is going to be the fastest way for us to notify folks about what's going on. And when we post something to the website, we'll send out something on our social media, but it really is going to be a way that we communicate with the state on what's going on. And then we're going to have March stakeholder meetings. There's the 3 dates. This is going to be, I think, posted to our website today, where you can sign up for them. They're generally meant to be the same information, all 3, so don't feel like you have to go to all 3, but certainly you might want to choose one of them. But if you can't go, we'll post a recording and the presentation on our website following the meeting. We also plan monthly stakeholder meetings, so we will have a stakeholder meeting every month, at least one, that provides updated information. We'll look at the report, we'll talk about, you know, what's it looking like, if there are any issues, and we'll also take questions so that we can provide that engagement with the stakeholders about what's going on. So that is as fast as I can get through that information.
Thank you so much. Will you send us the slide deck, or send Kelly the slide deck? Yep. So we can send it out to the hospital membership? I know my person saw it today, I think, and then she sent it to me this morning. So
yeah, absolutely. Yep. Happy to do that. And like I said, you know, still some things that are in play. We plan to keep all the MAC and TACs and other stakeholders updated. So we'll happy to come back and provide an update. And then we'll do that special webinar with the Kentucky Hospital Association as well. And for anybody, you know, we'll also post this on our website for anybody that wants to, that's not a TAC member, so they have access to it.
I think it's going to be obvious that we're going to have folks roll off from the current like 1.7 million. Is there an estimate of that number?
Yeah, so again, this is a snapshot until somebody goes through a redetermination. We don't really know, but we're looking at about 243,000 people is what our system is showing as of February 6th that have the potential of losing eligibility.
Okay. Any other questions from the TAC members?
And just
Veronica, it's Nina Eisner.
Hi, Nina.
I'm just wondering. Hi, I'm wondering about some of the waivers that were put into place during the public health emergency, like telehealth and no authorization, prior authorization in behavioral health.
Yep.
Do we expect any changes with those kinds of things?
So the telehealth is one of the flexibilities, and I had a couple of other slides, but I tried to keep this short. The telehealth is one of the flexibilities that we have implemented permanently to the extent that we are capable. So we filed a regulation and in response to a couple of pieces of legislation that was passed that did permanently put in place some of those flexibilities. The one caveat I just want to make sure people understand is right now the platforms, so the non-HIPAA compliant platforms like FaceTime are still able to be used, and the federal law in December extended that through the end of 2024. So there's some, at least some ability to forecast how long you can use those platforms after that date, and certainly we'll continue to communicate on this piece. It has to revert back to the Office of Civil Rights HIPAA compliant platforms, and those are just, we don't have control over that. So we will be sure to keep folks updated on that. But other than that, pretty much all of the flexibilities went into place. The prior authorizations is really not something that we asked CMS about. That was we did, but it really is up to the state with the discretion on that. As of right now, we do still plan to not put the prior authorizations back on the behavioral health services at this time.
Thank you.
You're welcome.
Any other questions?
All right.
Thank you, Veronica. I appreciate it.
You're so welcome. And I've got another meeting, so I'm going to jump off. But thanks for
Okay,
having
thanks.
me.
Have a good day. Okay, dish finalizations for the state fiscal year. I know we got the 19 letters last year, and that'll be finalized, I believe, by June of 23. And then June of 24 would be 20, and June of 25 would be 21. I know there's a lot of redistributions and some paybacks with these years with the UPL, and I just want to make sure, I think we need to get some information out through the Hospital Reimbursement Committee and KHA. Just want to make sure I have those right in my head.
So again, let me give you a few dates and some updates on those. On the 2019, we did notify those hospitals that did have a payback. We notified them on November the 18th of 22 with a due date of having those funds to us January 31st of 23. We still have about 2 or 3 hospitals that still have yet to pay that back. And we plan to process the redistribution of 2019 on March 31st of 2023, or by March 31st of 2023. That's the plan as of right now on 2019. On 2020, we have the finalizations are currently being reviewed. We anticipate to have draft results of those out by September of this year, September 30th of this year. On 2021, those surveys will be most likely due back to DMS on October 31st of 2023.
And then we could anticipate a similar type of redistribution timeline
Yes.
for 2020 in March or April of 24.
That's what our plans are, yes.
Okay.
Yeah.
Perfect.
I will add on one other thing. Your 2023, Veronica touched base earlier about the enhanced FMAP being phased out. We have the 10% remaining for your 2023 dish. In order to maximize as much federal dollars as we can, we plan to process those 10%, the remaining 10% payout that we would normally pay out in probably September. We're going to go ahead and pay that out by March 31st of this year as well.
Awesome. Great. Thank you.
Mm-hmm.
Any questions? Thanks, Steve.
Yep.
All right. Any other items from the TAC members? don't think we have any recommendations. I will represent the TAC at the next MAC meeting, and then our next TAC meeting is April 25th. I have a motion to adjourn.
I'll make that motion.
A second.
I'll second it.
Great. Thank you, everybody. The meeting is adjourned.
Bye, thank you.
Bye.
Bye.